Hi class, let's take a look at cranial nerves, okay? When we talk about cranial nerves, there are 12 pairs of cranial nerves, and you'll see that they're Roman numeral, right? So olfactory, cranial nerve 1, optic, cranial nerve 2, oculomotor, cranial nerve 3, trochlear, cranial nerve 4, trigeminal, cranial nerve 5, abducens, cranial nerve 6, facial is cranial nerve 7, vestibulocochlear is cranial nerve 8, glossopharyngeal is cranial nerve 9, vagal is cranial nerve 10, accessory is cranial nerve 11, and hypoglossal is cranial nerve 12. Simple way to remember these cranial nerves by their name and number. Let's see if we could draw it out for you. So we have O, O, O to touch and feel very good velvet. Ah. O to touch and feel very good, that's a G, very good velvet, ah. And it stands for, so let's say this is 1, 2, 3. Give me a second, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So O to touch and feel very good velvet. Ah, 1 is the olfactory, 2 is optic, 3 is oculomotor, 4 is trochlear, 5 is trigeminal, 6 is abducens, 7 is facial, 8 is vestibulocochlear, 9 is glossopharyngeal, 10 is vagus, 11 is the accessory nerve, and 12 is hypoglossal. Those are the 12 cranial nerves. Let's take a look at some of their functions. Cranial nerve 1, which is olfactory, deals with the sense of smell. These are numbered by the order that they actually develop embryologically. And it makes sense, right? You need to smell smoke if there's fire to protect yourself and save yourself. So that's olfactory nerve, sense of smell. We can see here is the entrance to the nose. Here is the cribriform plate. This is the skull. There's very little space between the nose and the brain, which is why you have to be careful with dirty hands touching the mucous membranes of the nose, because it can enter the brain through this olfactory nerve. You have to be really, really careful with that. Cranial nerve 2 is optic. Cranial nerve 2 deals with your ability to see. It's vision. Optic, vision. Okay? Optic, if I could say, how many fingers am I holding up, and you say 2, I know that you can see my 2 fingers. And what's interesting about the eyes is you can see that each eye has 2 sets of nerves, okay? So if we follow this, I'm going to use red, let's follow this one. Notice that this nerve stays on the same side of the brain. But the nerve on this side, let's see what happens to it. It crosses over to the other side of the brain. Okay, so when the eye is looking at and it sees some visual stimulus in the temporal field, that crosses over and hits this part of the eye. When there's information here on the nasal field of view, that crosses over and hits the receptors on this part of the eye. And the same thing happens here. Stuff on the temporal part of this eye hits this, and on the nasal view here, hits this. Why is this important? Right here is the pituitary gland. If you have a pituitary tumor and the tumor expands, it can create blindness to different parts of the eye. So some people may lose the visual field on the temporal field or the nasal field of one eye or both. Okay, that's because the pituitary gland comes very, very close to the optic chiasm. The chiasm is just the crisscross, the X where the optic nerves crisscross. Cranial reflexes, kind of neat. The corneal reflex, this is kind of neat. This is where the sensory part is cranial nerve 5 and the motor part is cranial nerve 7. If you get something in your eye like dust or a bug hits your eye, you blink, right? So 5 is sensory to the face, and 7, facial nerve, closes the eyelid, makes it blink. Direct light reflex, shining light into your eye. Well, if you can see the light, that's the optic nerve. And then when the pupil starts to constrict, that's cranial nerve 3, the oculomotor nerve. Okay. Okay, cranial nerve 3, oculomotor, it's going to, there's actually 3 cranial nerves that move the eye, okay? And they are going to be the oculomotor, which is cranial nerve 3, the trochlear, and the abducens. These 3 cranial nerves are going to move the eye. The eye has 6 muscles. So let's see if I can draw this out and show you. Here's an eye, and here's an eye, and here's a nose and a mouth. Okay, so the eye can move this direction, and the eye can move this direction. The eye can move that way, and the eye can move this way. So I'm going to name 4 of the muscles right here. If you move medially, that's called the medial rectus. If it moves laterally, it's called the lateral rectus. If it moves up and out, it's called the superior rectus. And if it goes down and out, it's called the inferior rectus. Okay, so those are 4 of the 6 eye muscles. They're called rectus muscles. Moving it in, medial rectus; moving it out, lateral rectus; moving it up and out, superior rectus; down and out, inferior rectus. There's only 2 other muscles left, and they're called obliques. The one that moves it up and in is the inferior oblique, and down and in, superior oblique. Yes, I know you'd think superior would be up here and inferior would be up here, but the obliques are actually opposite. The reason why I tell you this is once you know that, we can figure out which cranial nerves go to which muscles. There's Linder's chemical equation that's called SO4 LR6 all over 3. SO4 LR6 all over 3 tells you which cranial nerves go to which muscles. So SO4 tells us that this one here, the superior oblique, is the 4th cranial nerve. That's the trochlear. Lateral rectus, which is this one, is the 6th cranial nerve, abducens. All over 3 means all the other eye muscles are cranial nerve 3. Okay, so SO4, LR6, all over 3. Superior oblique is the trochlear nerve. Lateral rectus is the abducens nerve. And if you look at the word abducens, it sounds like abduct because it's moving the eye away from center. And then all the other eye muscles are cranial nerve 3. Okay? Okay, so there's the trochlear. We've already done that, which is cranial nerve 4, right? Remember? SO4, LR6, all over 3. So we know this is the superior oblique muscle of the eye. Okay, trigeminal. Very neat. Let's look at the trigeminal here. Trigeminal means 3. So the trigeminal has 3 branches. We call this V1, V2, and V3. V is for V, cranial nerve 5. It has three branches, an ophthalmic, maxillary, and mandibular. This controls the sensation to your face. This is the one when you go to the dentist and they want to give you a filling for a cavity, they have to give Novocaine to numb this cranial nerve so half your face goes numb so they can work on your upper jaw or lower jaw. So the trigeminal nerve controls the sensation to the face, but it also deals with the muscles of mastication. Muscles of mastication are the chewing muscles of the jaw, the temporalis, the masseter, and the internal and external pterygoid muscles. So your chewing muscles are controlled by the trigeminal nerve. There's a condition, a painful condition called trigeminal neuralgia, where people get lightning shooting pain to the face. It's actually considered a suicidal condition. It is the most painful neurological condition on planet Earth. It's called trigeminal neuralgia, aka tic douloureux. The abducens we've already done. We said it's SO4, LR6, all over 3. Abducens is cranial nerve 6, so it controls the lateral rectus muscle. Okay, facial. Facial controls facial expression. All the facial muscles, like raising your eyebrows, frowning, smiling, whistling, all the facial muscles are cranial nerve 7. The facial nerve also deals with sweet, sour, and salty to the tongue. Sweet, sour, salty, 7, right? Sweet, sour, salty, 7. It deals with sweet, sour, and salty to the anterior part of the tongue. And cranial nerve 7, also I make a hook to it, a hook, because with that hook of number 7, it closes the eyelid. Cranial nerve 7 closes the eye, whereas cranial nerve 3, 1, 2, 3, like the Greek columns, help keep the eye open. So cranial nerve 3 keeps the eyelid open, cranial nerve 7 helps to shut the eye. That's why when a bug hits your eye, you have to sense it first. That was cranial nerve 5, the ophthalmic division. And then when it hits the eye, 7 shuts it. So it's cranial nerve 5 and cranial nerve 7 for the corneal reflex to make your eye blink. Cranial nerve 8, vestibulocochlear. Vestibulocochlear. Cochlear deals with hearing, vestibular deals with balance. So this vestibular branch deals with balance, the cochlear branch deals with hearing. So when people have vertigo or they have um, uh, BPPV, benign paroxysmal positional vertigo, meaning they turn their head left or they turn their head right and they go dizzy and everything spins, or they lift their head up, or they're in bed and they turn over to the right and they get dizzy and vertigo and everything's spinning. That's a problem in the vestibular part, which is the semicircular canals, all of this. A crystal got stuck there. If it's a hearing issue, it's the cochlear portion. So that's cranial nerve number 8. Cranial nerve 9, remember 7 was sweet, sour, salty 7? Well, glossopharyngeal is the bitter back 9 to the tongue. Bitter back 9 to the tongue. 9 is here. Bitter back because the back of the tongue deals with bitter. 7 was sweet, sour, and salty. 7 was also salivary glands. Salivary glands. So sweet, sour, salty, 7 salivary glands. Bitterback 9 was just bitterback 9, but it also dealt with the parotid gland. The parotid gland, which we see right here. Parotid gland is controlled by cranial nerve 9. Cranial nerve 10, my favorite. Cranial nerve 10 is called vagus because it comes from the word vagrant. Look at where this vagus nerve goes. It goes to the heart, to the lungs, to the stomach, to the liver, to the entire gastrointestinal tract. And it begins in the medulla, and the medulla is protected by two vertebrae, C1 and C2. And that's why I love being a doctor of chiropractic, because we can make an adjustment to the atlas or the axis, influence the vagal nerve, and change blood pressure, help asthmatics, help detoxification, help digestion, help IBS, help gallbladder issues, high blood pressure, arrhythmias, right? Anywhere that the vagal nerve goes to, adjustments to the upper cervical spine could restore some normalcy and homeostasis too. So the vagal nerve is important. It also helps explain why birth trauma, if there's birth trauma and excessive force to the cervical spine, where it can subluxate the C1 and C2 vertebra, it can damage the vagal nerve. And this is where babies have cardiac issues or breathing issues, or can't hold down a meal, can't breastfeed properly because they have projectile vomiting, because they have valve issues to the stomach. The valves don't open or close properly from the esophagus into the stomach. So it's really important for newborns to get the upper cervical spine checked with every type of birth that takes place, because there could be anywhere from 60 to 90 pounds of pulling force on a baby's delicate cervical spine. And we want to make sure that the C1 and C2 articulation is healthy. There was a doctor many, many years ago in Europe by the name of Gottfried Gutmann, who autopsied babies that died of sudden infant death syndrome. He autopsied 1,000 babies. And what he found was that 100% of those babies that died of sudden infant death syndrome had what he called atlantoaxial instability. Atlantoaxial instability, atlanto comes from atlas, axial comes from axis. So if there's atlantoaxial instability, it's very likely that the unstable C1 and C2 subluxated or created nerve interference to the vagal nerve, stopping heart and lung function. That's sudden infant death syndrome. When babies lie on their stomach with their head turned, the atlas creates rotation, creates lots of impingement to that vagal nerve. Okay, we're almost done. Cranial nerve 11, the spinal accessory, controls the trapezius and the SCM muscle. And then cranial nerve 12, hypoglossal, controls the movement of the tongue. Okay, everybody. Hope you enjoyed that information.